As the world prepared to ring in a new decade, with fireworks and festivities planned for New Year's Eve 2019, a different kind of alert was quietly sounding in the city of Wuhan, China. Local health authorities in Wuhan issued an urgent notice. It was a bulletin about a cluster of pneumonia cases with an unknown cause. 27 people were sick, all linked to the Huanan seafood wholesale market. This wasn't just any market. It was a bustling hub where live animals, seafood, and a variety of other goods were sold. The notice warned medical institutions to be on high alert to track patients and to report any similar cases immediately. It was a cautionary measure, an attempt to get ahead of something they couldn't yet define. The news didn't stay local for long. The Taiwan Centers for Disease Control picked up on these early reports. Realizing the potential significance, especially with the high volume of travel between Taiwan and mainland China, they took a proactive step. They began sending emails to the World Health Organization, the WHO, informing them of the situation and asking for more information. They specifically mentioned the reports of atypical pneumonia and the fact that patients were being isolated, a clear sign that Chinese authorities suspected it was contagious. This early communication was crucial. It was one of the first international flags raised about the emerging health threat. Simultaneously, the WHO's own office in China picked up on the media statement from the Wuhan Municipal Health Commission about the pneumonia cluster. This confirmed the reports and triggered the WHO's internal alert system. A dedicated team, the Epidemic Intelligence from Open Sources Unit, began sifting through online chatter and official reports, trying to piece together a clearer picture. What was this illness? How did it spread? Severe was it? These were the questions that urgently needed answers. Think about the atmosphere at that time. Most of us were completely unaware. We were making resolutions, planning parties, and looking forward to 2020. Yet, behind the scenes, a small group of doctors, scientists, public health officials were already working around the clock. They were facing a medical mystery. The symptoms were similar to the flu or other respiratory illnesses, but this was different. The connection to the market was a key clue, suggesting a possible zoonotic origin and illness that jumped from animals to humans. In Wuhan, the response on the ground was immediate. The Huanan seafood market was ordered to close the very next day, on January 1, 2020, for cleaning and disinfection. Health officials began contact tracing, trying to find everyone who might have been exposed. Patients were moved to a specialized infectious disease hospital, Jinyantan Hospital, to prevent further spread and provide focused care. The sense of urgency was palpable among those on the front lines. They knew they were racing against time, but they didn't yet know the scale of the challenge they were up against. This day, December 31, 2019, serves as a powerful reminder of how quickly our world can change. It was the starting pistol for a global race to understand and contain a new virus. The initial reports from Wuhan, the early warnings from Taiwan, and the activation of the WHO's response mechanisms all happened on this single day. It was the first chapter in a story that would come to define our era. The information gathered on this day laid the groundwork for everything that followed: the identification of a new coronavirus, the mapping of its genetic sequence, and the unprecedented global effort to develop vaccines and treatments. It highlighted the critical importance of rapid information sharing and international cooperation in the face of a public health crisis. Looking back, it's easy to see the significance of December 31st, but at the moment, it was just a collection of concerning reports. It was a day of alerts and urgent emails, a quiet storm brewing while the rest of the world celebrated. It teaches us about the fragility of our interconnected world and the incredible dedication of the healthcare community. They are the sentinels, always watching, always ready to respond to the unknown. The events of this day set in motion a response that would test our resilience, our science, and our humanity in ways we could never have imagined as we counted down to midnight. It wasn't just the end of a year, it was the end of the world as we knew it, and the beginning of a new, challenging chapter in human history. As the days turned into weeks, the puzzle began to come together. On January 7, 2020, Chinese scientists officially identified the pathogen as a novel coronavirus. Just a few days later, on January 12th, they shared the full genetic sequence of the virus with the world. This was a monumental step. It allowed scientists globally to start developing diagnostic tests, understanding how the virus worked, most importantly, begin the journey towards creating a vaccine. The speed at which this information was shared was unprecedented in the history of public health. The World Health Organization officially named the disease COVID-19, which stands for Coronavirus Disease 2019. On February 11, 2020, the virus itself was named SARS-CoV-2. By then, the virus had already spread far beyond China's borders. The world was waking up to a new reality. Travel restrictions, lockdowns, and social distancing measures would soon become part of our daily vocabulary. Reflecting on December 31, 2019, is not just about remembering the start of a pandemic. It's about appreciating the complex global system of surveillance and response that is constantly at work. It's about honoring the first responders, the doctors in Wuhan who raised the alarm, the officials who made difficult decisions with limited information, and the scientists who worked tirelessly to decode the threat. This day also underscores the vital role of transparency and communication. The initial notice from Wuhan, though limited, was the spark that ignited the global scientific investigation. The questions raised by Taiwan highlighted the need for vigilance and cross-border collaboration. Every piece of information, no matter how small, was a critical part of the puzzle. The story of COVID-19 is still being written, and its impact will be felt for generations. But its origins, the very first steps in our collective journey, can be traced back to this one day. As the confetti settled on New Year's celebrations, a different kind of global effort was just beginning. It was a fight for lives, a quest for knowledge, and a test of our shared humanity. The lessons learned from that day continue to shape how we prepare for and respond to future health emergencies. Strengthening global health security, investing in research, and fostering a culture of open communication are more important than ever. December 31, 2019, was a day that changed the course of modern history, reminding us that in an interconnected world, an unknown threat anywhere is a potential threat everywhere. It's a sobering thought, but also a hopeful one. It shows our capacity to come together, to innovate, and to overcome immense challenges when we work as a global community. The journey has been incredibly difficult, filled with loss and hardship, but it has also been a story of incredible resilience, scientific achievement, and human compassion. And it all started with a simple health alert on the last day of the year. Thank you so much for watching. If you found this look back at history interesting, please consider liking this video and subscribing to our channel for more stories about the pivotal moments that have shaped our world. Stay curious, and we'll see you in the next one.